Hi, my name is Kara Richardson, and I'm one of the PAs here at Premier Dermatology. And we're going to be discussing Botox today. What it does is it actually blocks the connection between the nerve and muscle. And by doing so, it doesn't allow those muscles to wrinkle or move as strongly and create wrinkles in the skin that in time can be there even when you're not making that movement. So when we're young, we're able to make as much movement or expression as we want, and you don't see those wrinkles. But as we age, unfortunately, that collagen production starts to decrease, and so you start to see some of those lines being etched in the skin all the time. So Botox allows us to play a little catch up. I'm going to show you today some of the areas that we treat and why we treat them. Biggest thing about Botox is we want to make sure that you have a natural look, that you don't have any abnormal expression or what some people call spocking of the brow, where they're too sharp and too high. So we want to make sure we address all areas so that they move smoothly or evenly and natural. Okay, so first I'm going to start by just marking some of the areas on Miss Kim's face and let you see what wrinkles are most commonly treated with Botox. Miss Kim always is bothered by these lines on her forehead along with these lines around her eyes. So those lines are definitely going to get addressed with the Botox, but one of the main things that I always feel like I'm explaining to patients is you don't want to only treat your forehead. You really need to treat also what's called the glabella. Miss Kim luckily doesn't have really deep furrow lines or deep frown lines, but if we don't address this area, she will not get a nice lift in her brow. So I'm going to show you with her making some movements for me. Frown really hard. These muscles right here are the muscles that really pull down on that brow. There's also some pulling that happens in this lateral brow, and we want to address that too, so that when the Botox is working and when it's blocking that nerve muscle interaction, that we get more lift from her forehead. So raise your eyebrows really high. And she does have some lines that are etched in her forehead. We want to make sure we just soften those. If we block those completely, Miss Kim is not going to like her results. She's going to feel like instead of getting a brightening to her face, that I made her feel heavy or look more tired. So in these particular areas, we want to make sure that we, again, use maybe less units, but also very specific placement. So in her case, we're going to stay really high on her forehead, and we're just going to address it in a few points with a small amount of Botox in each of those points. I do want to point this out on Kim here because you can see that she is a little bit stronger here on this right side. So we may put an extra unit there just to balance her forehead and balance her brow movement and that lift that she gets with the Botox. Some other areas that we're going to treat on Ms. Kim are especially around the eyes. She has beautiful, beautiful blue eyes. And as we age, the stronger those muscles get and some of the volume loss that we have in our face, I feel like we start to notice that when we're taking pictures, we don't see as much of our eye. So the Botox can help us brighten that eye back up. Smile really big for me. And we're going to address just in kind of 3 points to just soften it. We want her to still have these cute little lines that happen with her smile, but we want to address some of what we call those cheek lines. This one that's much higher is going to address that pulling on the brow that wants to pull it in when you smile, which closes that eye a little too much. Another area that I love Botox that you may not hear as commonly is the lower face. So we have a few places where we start to see shadowing and pulling that we don't always love. And that's here in the chin and in this. When she makes that motion, it creates a creasing, but it's also pulling the corner of the mouth. And the more that we relax that, the brighter that lower face is going to look. So a couple of places there. Relax. Good job. Do it one more time for me and relax. Okay. And then on her chin, we kind of hit it in just a 3-point to just soften, because this muscle, what it wants to do is get really tight. And when it does that, we get some dimpling, what people refer to as orange peel or the golf ball chin. And so we want to relax that so that that texture looks more smooth, which is always a brighter look. So now let's talk about Botox and what you should expect at your treatment. So depending on when you start doing Botox, if you are starting in your, say, early 30s, late 20s, and those wrinkles are pretty minimal, you're going to see your results in 5 to 7 days, and those wrinkles may in fact be gone. Someone who starts in maybe their late 30s, early 40s, you're going to still see results at 5 to 7 days, but you may not see those wrinkles completely gone. That goes back to the catch-up. So if we are starting later and the wrinkles are in fact deeper, what we want to do is make sure we keep those Botox treatments up and as often as usually about 4 months so that those wrinkles can continue to fill in with time, because we've relaxed the movement with the Botox, and during the time it's in play, there is not going to be collagen breakdown. So you're going to start to see those wrinkles fill in with cell turnover and natural exfoliation. Don't be discouraged if the wrinkle's not completely gone with your first treatment. Give it some time and it may resolve. The other thing is we always do a 2-week follow-up to make sure that we got the right amount. So in Miss Kim's case, if she was coming to my chair for the first time, I may treat only her glabella area and her crow's feet, and then see her back at 10 to 14 days and address her forehead, because I want to see how much relaxation happened in her forehead and not over-treat it, because that's where you're getting, again, that lift. Botox is going to last 3 to 4 months in the average patient, so you need to plan to repeat your treatment in order to keep your results. Minimal downtime of, maybe 15 to 20 minutes of a little swelling or a bee sting, and then you could have some bruising, but it's not common. And usually easily covered with makeup. We tell you just, don't have something immediately after your treatment, but, a few hours, you're just fine to go on and do normal activity. We do limit exercise for the first 48 hours. We want to make sure that Botox gets into full effect and doesn't have excessive metabolism that might not allow it to work as well, along with excessive heat. So no hot tubs, no saunas, those things for about 48 hours. And then no extreme massaging to the area for 1 week. So no facials, no any kind of laser treatments for at least a week. We just want to give it time, because that Botox is going to take that 5 to 7 days to really kick in. And we want to be able to see that and not have any issues. Once we kind of find what your face, because every face is different, what your face needs, then we're able to repeat that treatment on a 3 to 4 month basis. I'm going to get started and show you just a few of these injections and show you what to expect as far as visually afterwards. So we're going to get started here on her forehead. And so even though I've marked her, a lot of times we'll ask you to make that expression again, just so we can see those muscles really, really well and make sure we're addressing them in the right way. So Miss Kim, frown for me really hard and relax. And usually we would do a little ice pack prior to the injections. Today we're making Miss Kim be tough and do it without, but the ice does help. So just know that's an option. I think Botox is, for most of my patients, always surprisingly easy. They expect it to be more painful or more involved than it is. Smile big for me and relax. Smile big, and then I'd like you to close your eye really, really tight for me and relax. And this is that lift on that brow, because we're all a little prone to having those brows pull in with time. Now we're going to do a little bit in this lower face. All right. Yep, and relax. That chin is always a little tighter, so sometimes it's a little more pinchy. And then I'm going to have you make that little expression with your lower face. And what we want to do is just address that little muscle. Relax, pinch, which is just going to give those corners a nice lift. So one last thing, people always ask me, is everybody a candidate for Botox? Truthfully, yes, there are very few autoimmune things that may not allow for Botox treatment, but as far as age and things like that, if the lines are something that are due to expression, we can usually always at least soften them. We may not get rid of them completely, but It always come in for a consultation. Let us look at you and decide if you're a good candidate. And we're here for you anytime you need us. Thank you.